I tried to stand up to go to the bathroom, and I fell onto the ottoman a couple of times.
I had no clue what was going on, and I just didn't know.
But then he said, "Okay, we're going to the hospital. Put your arm around my neck, and I'm going to carry you to the car." I said, "I don't know where my hand is."
I remember pain in my neck and my grandma being worried about it.
I actually had gotten a phone call from my mother-in-law, and she said Dane wasn't using his right arm and that he was awfully quiet. She wondered if he was homesick.
My dad came and got me, and by that time I had lost my ability to speak.
When Dane got home and I saw him for the first time, I tried, talking to him, and he couldn't articulate his words, and he had a full vocabulary, at 4, and he was riding a bike without training wheels. He was, an active 4-year-old. I put my hands and held both of his hands and said, "Dane, squeeze my hands," and he could not squeeze on the right-hand side. And when he got up to walk, he would drag his foot.
I was upstairs getting dressed, and I was putting my socks on, and all of a sudden the right side of my body just went numb. I had no feeling whatsoever, and I had no motor control over the right side. And so I kind of scooched my body up toward the phone, and I was dialing numbers, but not sure what numbers I was dialing. After misdialing 3 or 4 times, the number went through, and my wife answered the phone. And at that point, I still didn't know what happened to me. I didn't know that I had a stroke. I guess I should have. Well, I was scared out of my mind. I really just didn't know what was happening or what was going to happen.
Typically what happens in the chain of events is it requires the general public to first of all know the signs and symptoms of a stroke.
So the easy way to recognize a stroke is with the acronym FAST. F stands for face. So you would have somebody looking at you, and they would maybe have some weakness on one side of their face than the other. Their corner of their mouth may droop, their eye may droop, and it may droop on the whole side, or it may just droop in a partial. The A, you would ask somebody to raise their arm up. If they're complaining of arm weakness, you would have them hold their arms up, and one arm will slowly drift or actually drift to the ground, to the side of them. As far as speech, you may have them repeat a sentence after you,
Can you tell
to
me
see
your name?
if they can do that, if it sounds clear. They may not be able to talk at all either. They may just be talking in garble and not understand anything that you are asking them to do, and they just may have a blank look. And then T is time. So the most important thing with the time aspect is to call 911, because our EMS personnel are especially trained in the treatment of patients to recognize those symptoms and treat them as quickly as possible to get them to the hospital. And then they alert our emergency department that they have a potential stroke patient coming in, so that alerts our stroke team on our side.
The earlier we can get the patient to the hospital before about 6 hours or so, the hospitals have the ability to provide some medications that may be able to either break up a clot or go ahead and perform some interventions to go get the clot and remove it.
Every minute that goes by with a stroke, 2 million nerve cells are lost. Now we have 100 billion, however, that's still a very rapid process.
The story really begins at that phone call from EMS.
Positive facial droop, altered level of speech, positive arm drift.
So when they call us pre-notification, we immediately notify our stroke team.
Call it code gray.
So while EMS is in the field taking care of that patient, our neurologists are getting here. So by the time that patient arrives, the neurologist is oftentimes standing at the door waiting for that patient.
No recent surgery. All right, John, hold both arms up, please. The idea here is we're trying to make a very rapid assessment of what is going on so that we can treat a person as quickly as possible.
After I got to the emergency room, they gave me something to lower my blood pressure right away. I was having another hemorrhagic stroke. They were so fast and so efficient. They knew exactly what to do, and it was the greatest thing.
Dane saw a neurologist right away. They ran tests, and that's when we discovered that he had a stroke. And so they sent him to the Children's Hospital in Indianapolis at that time. When we were done, came back home, he had therapy at BroMenn. He had about a year of physical therapy, speech therapy, occupational therapy.
Once we get our patients stabilized and we figure out their treatment plan based upon what their actual diagnosis is, we have a neuro unit here, and we start discharge planning on day 1. So there's no laying in bed, we're getting them up, we're getting them moving, we're getting them the proper treatment.
The therapists at BroMenn were outstanding. They were wonderful, they were supportive, they were enthusiastic. They came into your room and they made you smile, but they worked me very hard. I remember one day they put a weight on my right leg, and they asked me to pick up my leg. And I was laying flat on my back, and I picked up my right leg, and I was able to get it up about an inch off the table. And I tell you, it was the most challenging thing that I ever faced, trying to hold my leg up like that. And after the fact, I asked, how much weight was on my ankle, and they said it was 1 pound.
I went to the Advocate BroMenn Center for Outpatient Therapy. I loved my therapy out there. They kept getting me up and walking me. I mean, my husband Dave was wonderful about taking me out for a walk. We'd try and go a little bit further each time. Eventually, the dragging the foot got better, and I wasn't dragging my foot at all. And then I was able to actually go out by myself for walks.
Definitely, there's improvement, most of the improvement, within the first 3 months, whether it be improvement in strength, return of sensation, improvement in coordination, or improvement in vision. So really, when I talk to my patients about their prognosis, I try to emphasize that there is definite hope for improvement, even though this has occurred. And patients are pleasantly surprised many times.
At first, I didn't want to wear a shoe insert because people would ask me about it at school, and I'd be like, oh, I had a stroke, blah, blah. But now when people ask me about it, I feel more than able to talk about it just because I know that it's part of who I am and part of who I'm going to become.
I actually had stopped up at the hospital once, and one of the therapists asked me to come in and talk to a patient, and I did. And they were amazed to see me. And what I tried to tell them was, if you do what you need to do, if you apply yourself like your therapists say, if you follow what the doctor's telling you to do, and you really make an effort, while there's no promises, you can try and advance yourself as far as possible.
First of all, have your blood pressure checked. That is probably the biggest risk factor for stroke. Make sure it's under control. There are no symptoms of high blood pressure, so it just needs to be checked. Secondly, have your cholesterol checked. Thirdly, if you do have risk factors for stroke, talk to your doctor about what blood thinner medication you ought to be on. Talk with your doctor about your heart condition. Do you have any heart conditions that will put you at risk? So start early, no matter what your age.
I'm staying in shape, and that's one of the things they told me at the Advocate BroMenn Center that was very, very good, is that I was in really good shape before I had that stroke. And because I was in good shape, I was able to bounce back a little bit faster. So I'm still trying to stay in shape and to stay as healthy as I can. And calm. I'm a lot more calm now than I used to be. Everybody tells me that.